this hybrid meeting where partners are on virtual, and we're here in physical presence with the Director of Public Health. So the first item on the agenda is to confirm a true record of the minutes of the meeting held 1st of March 2021. Committee, are we happy with those minutes? Michael?
As I'm and yourself are the only ones there, I propose them as a true record.
Can I second?
Yes.
Yeah. Okay, right. Jolly good.
Actually, Chris was as well.
Has anybody got any interest that they can think of that they'd like to declare up front? Karen?
I'm self-employed and I work for the PA Notice Board.
Thank you, Karen. Noted. Public questions.
So,
have we? Sorry, Michael.
I'm a chair of the local Isle of Wight Voluntary Sector Forum, and in relation to mental health, I am a trustee of the Isle of Wight Youth Trust. Thank you.
Thank you, Michael. Okay. Public questions. Have we had any? No questions. Right. So we'll go straight on to the business. Simon, would you like to update us on COVID-19, please?
Thank you very much, Chair. I'll just give a very quick update, and obviously very happy to take questions. I think that's more beneficial than go through a long presentation. What we've seen with COVID most recently is an increase in the rates of all ages and 60 plus, particularly this is around rates of infection rather than anything else at this point, but we are seeing higher rates in those teens and working age population 2024 with a rate of, this is a 7-day rate, so the new cases of 418. So really increasing, and our positivity has also increased to 3.6%, still below the 5% where we think the epidemic is spreading. With regard to hospitalizations, they remain low, and deaths remain low or zero as well. What we're seeing though around the country is an increase in rates of COVID across the whole country. And we know that's mainly around cases, but we are seeing more hospitalizations around the country, which is obviously a concern, and we're looking at that. One of the key things that we need to do to prevent spread is keep the vaccination program up and running. We're doing a really good job there. So 73% of the adult population is fully vaccinated and 85% have had 1 dose. So we're doing a lot of work to increase that. We know that's one of the key things we need to do to prevent spread. Most recently, it has opened up to younger people a little while ago now, but we still need to encourage that population to take up the vaccine program. So there's a number of things we are doing to increase that, including targeted comms, working with colleagues, and that's led very well by our NHS colleagues. So all in all, we're in a position where we're seeing increasing rates, and we will likely to see that going on through the summer. As we have, as people know today, we've opened up society to see more people able to mix. As we see that, we are likely to see more cases and then consequently a small increase in hospitalizations. Chair, I'll stop there, but happy to take any questions or focus on a particular area if helpful.
Thank you very much for that, Simon. Councillor Mosdell.
Hello, Simon. For me, thank you for the update. I do appreciate that. And thank you to Alison and everybody who's been involved in the vaccination programme. It has been absolutely a stunning effort. For me, I do think there needs to be some level of positivity that's reported in the media. So I did a quick Google yesterday, and the average deaths across the whole country last week were 8,508. Of those, we're looking at COVID being some days 25 or maybe 42. And I think at some point, I'm not saying that we have to all rip our masks off and go dance in the street, you know, and kiss everybody you see, but actually there has to be a level of positivity reported in the press, because the effects of this pandemic on people's mental health is fear. You know, people are worried to go out and they are worried to start leading a normal life. You know, I went to Morrison's this morning and it was fantastic. I didn't see anybody not wearing their masks. I think people are having a level of sense to it. But I also think there needs to be more reporting in the press of actually where we are with this and how can we encourage that from an island level to have a bit more positive reporting. And if we carry on with the vaccinations, this is the rate that we're going to go.
Thank you for that. Simon.
Yeah, thank you, Councillor Morsdale. I think you're absolutely right. You know, we have seen a huge change from where we were in January, and let's see, we move a long way forward and we're doing very, very well. It is my role as Director of Health to be cautious but positive and say, actually, as we open up, as you say, people are being really sensible. Let's really keep those messages going so actually we can continue to enjoy the freedoms we are now enjoying and really promote the vaccination, because actually, as you say, that's where we're going to carry on, be able to move forward and you know, move forward with society. So we absolutely agree on how we manage that. I'm sure we can work with the brand on the radio tomorrow, so I'll make sure those messages are shared.
Yeah, thank you. Do you agree with me that we should have some more positivity within the press, that when they are doing and the rates are going up, we also need to make sure that we're adding that bit, like you started your conversation, that there aren't as many people being hospitalised, there aren't how many people on ICU beds, that sort of positive message as well.
And yes, we've come a long way. I think when I've briefed this committee previously, we were in a very difficult place with high hospitalisations, and we're not there. You're absolutely right. And I think as we move forward, we say that is really good. Let's be cautious as we open up. But the good news is, as you say, that people aren't getting as seriously sick. I have to say, what we know is those people who tend to be in hospital are those who haven't been vaccinated. So we really need to encourage vaccination for those people. That's across the country rather than the small numbers on the island.
Michelle, did you have your hand? Oh, Alison, did you have your hand up?
No, I didn't.
No, okay. No, it's just on the screen. It had a red dot. It might have been.
It's Darren Cattell.
Oh, it's Darren who had his hand up. Darren, did you want to say something then?
If I can, Councillor Nicholson, can everybody hear me? Yeah.
Yes.
Great. Thank you very much. The technology works. That's brilliant. Thank you very much for facilitating this. Really very pleased to be here. Just to give a bit of context to the discussion there, point raised by Councillor Mosdale, I am by nature a very positive person. I do worry, though, that we are seeing it is a small increase in the hospitalisation rates for the population. We now have a very small number of patients with us that are COVID positive, including one patient within ITU. So it is something that's changing. And although we do need to be positive, we do also need to consider the health aspects for our population. So it's just a balanced perspective as we move forward, please.
Thank you, Darren. Councillor Lilly.
Although I agree with the feelings from Councillor Mosdale about being positive, I also feel we need to be cautious, as just said, because you are, I think, getting a lot of my question really to you is there seems to be an increase in people isolating. Their app is pinging, right, all over the place, and particularly is affecting the hospitality trade, where you've actually got a number of businesses that have literally got, we've had to close because of isolation of staff. That seems to be increasing. I think there's a number of people, young people, within families, affecting, as you know, on the Isle of Wight, we have quite large families, right? Or, bubbles are quite big. And there is reports through networks. I have in my ward alone about 20 households isolating at the moment, right? For, because of contact. And I think that my concern is that a number of businesses are, looking at getting their staff to turn off the apps because they literally are worried about the fact that was going to affect them financially. So I want to talk about the other message. How do we get over to people who start to feel that we can actually get rid of the rules, right? We can turn off the app. How do we get the message to actually this is still important?
What you're saying, Michael, is that we should give out a positive message, but not be blindly overconfident, because that would be rather stupid.
Because I think the reality is, if you're asking the community, they will know of someone who's isolating at the moment, and they'll know of someone that has actually got COVID. It might not, at the moment it seems to be, I'm picking up with younger people, and that might not get into hospitalisation, but it is there. And I think we can't close our eyes to it.
Cautious
and there is a
optimism.
risk that there could be increase. Look at the numbers of people coming to this island at the moment. It is, we are rammed at the moment on this island with visitors.
I've got Rodney, I've got Karen, and Carl wants to say something. So that's Rodney first. Councillor Downer.
Oh, that's better. Yeah, thanks for your comments, Simon. But what I would ask is that, hey, what would your sort of advice be to people? How do they disseminate all the information that they're getting from, say, like the press and the news and all that sort of stuff? One person saying one thing, another person's got a different view. It's all very confusing. Thank you.
Thank you, Rodney, as ever.
Shall I come back on both those points? So firstly, Councillor Lee's right, contact tracing is one of the key tools we have to prevent spread. It's really important. I realise it's really frustrating with, it affects all of us. And I think we just need to remind that's one of the reasons we isolate, to prevent spread, and it works. And we need to keep that up whilst we are still rolling out the vaccination programme. I do agree the advice and things change, and there's been a lot of advice changing over the last few days with the opening of society. We need to make sure our messages are clear. Working with the comms team here in the NHS, we are getting those messages out to really explain to people what they need to do if they're contacted, what they need to do to keep themselves safe. We're all working socially distanced, and I know that's frustrating, but actually that is helping keep all of us safe. So how do we do that and keep those messages going? So I would just say, remember hands, face, space. Actually, those are key things we can do to prevent spread of this virus.
Councillor Joni.
Hello, Simon. We haven't met yet, but hello. But so I'll go back to the point where you were talking about younger people not picking up on it. Is probably why we're on 73%. Is it diluted with that age?
So the uptake is good on the island of the vaccine, but there are some people of all ages who haven't taken it up. But because the younger population have been eligible for a shorter amount of time, they are a little bit slow to take it up. And we're doing things like pop-up clinics and grab a jab to really encourage them to take that up. And that is working, but we need to go harder on that for those younger people under 25.
That was actually my next question. So, of course, on the 16th of August, if you've been double jabbed, you don't have to isolate. Is that correct? So I think that's probably quite a key message for people, isn't it?
Yeah, I think it's the 19th, but you might be right. I've got so many dates in my head as counts down. But you're right. If you are then double vaccinated, you would not have to isolate. We need to really clear what that means and how we show that. So we're working through that. The guidance hasn't quite come through, but we are working on that now.
I've read it this morning, but I think that's the positive message that we need to get across.
Thank you. Councillor Love.
Thank you so much for allowing me to come in, not being a member of the committee. I think it's really important to say a huge thank you to our officers and staff who've done an incredible job during this pandemic. I think it's a case of balances and checks, isn't it, just at the moment? I mean, economically, we've got to remember the island has some very specific issues, such as those that are occurring with Red Funnel at the moment, and the impacts and delays that that's causing on the whole island. And those are very specific things that the officers and other people are trying to work with. I think we've got to maintain and certainly our schools are maintaining until the end of term the message about wearing masks in schools. It makes perfect sense with, you know, just this week to go before they all break up, to maintain that for safety reasons. But this is not a free-for-all. We must remember that whilst we need to project as positively as we possibly can, that we mustn't give any signals which give the impression of it being a free-for-all and people going out there and just doing as they want. But thank you for all of the work that everybody's done, and thank you for the comments you made.
I think I've got Alison with her hand up, and then I've got Councillor Mosdell. Alison, did you have your hand up?
I did, Councillor Nicholson, but everyone's mentioned the points I wanted to make, which was to reiterate about the vaccination, mask, wash your hands and space. So thank you, everybody.
Jolly good. Closing remark, Councillor Mosdell.
It's not a remark, it's a question. It's probably for Dr. Legg. So I have been reading some stuff about the vaccination programme that would need to start in September, when we think most clinically vulnerable and the oldest had the vaccinations first. How long do we think that the level of that vaccination actually gives you the heightened level of resistance to the virus? Because would it not be that we would start to have to giving the third dose of the vaccine to those clinically vulnerable and the oldest in September? And is it true that we will be looking to do that time like a double jab? So you go in flu and COVID at the same time. Do we have any data at all how long we think the vaccination, the COVID vaccination, actually has its full height of actually being the most resistant to the vaccine? And is that September date looking like probable that we'll have to start double jabbing people? And my other part of that question is, will that be a choice thing? Because I know some people have had reactions to the flu vaccine in the past. And when are we going to start giving out the messages that actually flu can kill as well? So you do need to have both of those vaccines. So a bit of a long-winded question. I apologise, Dr. Legg, for that.
Thank you very much, Councillor Mosdell. I hope you can all hear me okay.
Yes.
Fantastic. So the plan presently, we had some guidance released just literally within the last 48 hours, is to actually start vaccinating as much as possible in September, and doing both flu and COVID at the same time. So that would be jabbing, you know, the groups that you've mentioned, Councillor Mosdell, in both arms, you know, one arm and the other arm at the same time. So we would be encouraged to do both flu and COVID at the same time as much as possible. Of course, there will be situations when, for example, people can't have the flu vaccine for various reasons. And then obviously we will take steps to do, for example, the COVID vaccine at that time. We will be able to flex the vaccine programme to accommodate all sorts of variations in what we can and cannot do. As you know, Councillor Mosdell, it's a brand new vaccination programme, and presently September has been muted, in which we start vaccinating the booster vaccine for COVID, because they think that levels will start to drop then. But it's not a cut-off. It's not that they will suddenly start to drop at that point. It'll be a very gradual decline, if at all, at that point. And people's response to the vaccine actually differs. But we will start with those groups in wave one, and we will move to the other groups as we progress through, and that's the plan. So your questions were quite long. I think I've answered both of them, hopefully.
Thank you very much, Michelle. It's a very, very full answer. Thank you. So we'll move on to the next item now, which is adult social care. Carol, Dr. Tozer, would you like to, would you care to just give us a brief introduction on this?
Yes, thank you very much. And I should perhaps explain that I'm not physically present at the meeting because I am isolating currently, but not because I'm COVID positive, but because my husband goes into hospital tomorrow, and therefore he has had to isolate for the previous 3 days as well, since he's had his PCR. So my apologies for not being there in person this evening, Chair. What you have in front of you is the annual complaints report, and we do have Helen with us, who's available to give some wider introduction to it, as well as answer any specific questions. By way of introduction, this is a statutory requirement because complaints matter. What I would point out to you is that of the 41 complaints that we've received in the year ending the 31st of March 2021, that represents 0.5% only of all of the requests for support that we've received, and it compares, those 41 complaints compared to 299 compliments that the department has had. In wider context, I think colleagues are aware that we introduced Care Close to Home on the 1st of April 2017. And I'm therefore very pleased to note that whereas in that year, the 16-17 year, we had 82 complaints, that reduced to 77 the year after, 73 the year after that, slight increase to 75. So 41 is the lowest number of complaints that we have received for quite some time, and very much on a downwards trajectory. The report in front of you gives very important detail with regards to those complaints which have also gone to the local government ombudsman. And it's really important that people have the right to do that. So whilst we investigate each and all complaints, and we seek as much as possible, and indeed, you can see in the report that 47% of all the complaints in the last year were successfully managed informally. Regardless of the outcome of complaints, it's people's right to be able to continue to raise their concerns with the local government ombudsman. So Helen's report in front of you today has some important outcomes for what the local government ombudsman has found, and specifically found fault in 2 cases, one of which, although it was dealt with under the adult social care, actually was a complaint which was around a DFG, and therefore was another part of the council, but nevertheless is reported in front of you. And another one where the fault was found resulted in us needing to write a letter of apology rather than any other additional requirement made upon us by the local government ombudsman. So the complaint, the report in front of you is pleased for you formally to receive. Where complaints absolutely are made and investigated, regardless of whether they're upheld or not, this report makes very clear to you how we deal with them in terms of learning the lessons. And Helen, as our statutory complaints officer, is nothing if not tenacious with managers, including myself when needed, in terms of making sure that we do learn each and every lesson from complaints, because they are really illuminating and can only help us to further improve the way in which we operate in terms of seeking to achieve best outcomes. And I think for the first time in Helen's annual report today, there's a very important additional section as well around integrated approaches, because the more that we integrate across health and social care, sometimes it's very hard to disaggregate where a complaint has come from, and we need to look across the entire health and care system. So Helen has very helpfully added in a section in on that. I wish to just very quickly ask Helen if she wishes to add any substance to the generics introduction that I've just given, and then of course Chair would be very happy to answer any questions that the committee might have.
Thank you very much.
Hello, thank you, Carol. I think Carol's covered off all the main points of context in the report that I wanted to highlight. I think just in terms of the local government ombudsman, I would just draw your attention to the fact in the Ombudsman's annual report, the Isle of Wight Council had a 47% upheld rate in complaints they considered. Those are not only statutory complaints, they were corporate complaints as well. And that uphold rate is way below the 56% in similar authorities across our area. So in terms of performance, the Ombudsman drew our attention to that. And the only other thing I wanted to highlight was the timeliness of our complaint handling. Our own complaints policy states that we have 25 working days to complete an investigation and provide a written response to a statutory complaint. Our average timeliness with complaint handling was 14.37 days in this reporting period, which is well within our own policy timescales and considerably well within the statutory regulations, which gives a guidance of 6 months to resolve a complaint matter. So in terms of endorsing the LGO approach, the Ombudsman's approach for fixing matters upstream whenever is possible, it certainly demonstrates that we are proactive in responding to people's complaints and concerns. And when they do go into formal process, they are provided with a timely investigation and a written response. And apart from that, I think Carol's covered off all the main other context that I wanted to bring from the report. So I'm happy to take any questions if anyone's got any specific.
A lot of people don't like to complain, and of course complaints are just one form of feedback. So does a complaint become a complaint when somebody formally complains, or do you actively seek feedback and channel it into complaints or thanks or whatever?
Do you want me to take that, Carol?
I will refer you to the next report, which does say and give some results, Chair, around the findings of this year's user carer survey, which is the national survey which we have to undertake, and that gives you some context around what it is that people think about adult social care on the island, and what you will see in terms of that, and I'll just give you the page number in your pack of reports before you, because they're very helpfully paginated. So I'm just scrolling down. So on page 32 of the documents in front of you, committee members, what you will have in the penultimate paragraph on page 32 are the results of the user care survey, which we received in March. And what that revealed was, of 151 upper tier local authorities, we were the third highest council nationally in terms of users' ratings of their social care related quality of life, the 18th highest rated council in terms of users stating that they had control over their daily lives, the 14th highest rated council in terms of users agreeing they have as much social contact as they would like, the 20th highest rated council in terms of users' overall satisfaction with their care and support, and the 22nd highest rated council in terms of users stating that their services made them feel safe and secure. And all of those results, Chair, place the Isle of Wight results in the 15th highest percent of all councils in England.
I think this report and the service you provide, Carol, needs to be commended. It's so positive, and I thank you for the effort that you've made. I've got Councillor Lilly.
Yes, I thank you. Thank you for the report. I've got two specific questions. One is on the complaints. There's obviously been a reduction. I just wanted to clarify: has there been a COVID effect? Because obviously this covers a year where we've been in a pandemic. Has there been less? Have people been less likely to complain because of other worries, as it were, with the pandemic? So that's my first question. And my second question is, what is planned to reduce the number of complaints further, and move down from this 40% upheld by the Ombudsman? Obviously, that is below the national average, which is fantastic, but we should always be pursuing to reduce things further. So what action is going to be planned to reduce the number of complaints in the future? Thank you.
I think the first part of your question, Councillor Lilly, is an interesting one, and I think maybe we won't be able to see maybe the effects that COVID has had on complaints and complaint numbers until certainly a little bit further down the line. It's been really evident from talking to colleagues across the Southern region, and I'm a member of the Southern Region Complaint Manager Group. Talking to other complaint managers across the region, every authority has experienced the same, which is a downturn in the numbers of complaints. And it could be due to a number of factors. It's certainly, for some people, the pandemic's exacerbated their levels of anxiety. For other people, it's provided a distraction. And so, as you quite rightly say, they maybe been focused on other things rather than making a complaint about something. And for other people, it has to be said that it's brought about a new appreciation of public service. So that could be argued that it's that's the reason for the downturn in numbers. I think every complaint manager has reported that they have seen that definitely evidence of that increased anxiety, people's increased anxiety. But it's not translated into complaint numbers. So I think all authorities have reported they've seen a downturn in complaint numbers. I think all authorities are actually waiting for a potential surge in complaint numbers as we start to come out of, hopefully, the other side of this, this period. Interestingly, the Ombudsman themselves paused their complaint activity at the beginning of the pandemic last year, from March to June. And it was actually thought at that point in time that that would cause a surge in complaint numbers and some sort of bottleneck in complaints coming through. That hasn't happened yet. We didn't pause our complaint activity. We carried on business as usual, process as usual throughout the pandemic, as did, I think, all of the authorities I spoke to across the Southern region, apart from Southampton, who did pause their complaint activity. But interestingly, the complaints manager from Southampton has reported that when they restarted their usual process, they too haven't seen a surge in complaint numbers. So I think it's very much a developing situation. I'm cautious to use the pandemic as the reason for the reduction in complaint numbers yet, because we don't know, and I don't think it will be into the next reporting period until we may know that and what effect longer term that has had on complaint numbers. But certainly in the shorter term, it doesn't appear to have had the effect that we thought it was going to have. And the second part of your question, in terms of reducing the upheld rate at the Ombudsman, it's certainly something I don't think the Ombudsman would endorse. In fact, I know it wouldn't endorse that. It is very much going back to the point Carol made at the beginning, which is about people's right to complain and people's right to be heard. And it's absolutely about demonstrating an organisation's transparency, ability to look inward, and be transparent about responding to people's concerns and complaints. So whilst yes, we do have an uphold rate which is less across the board than similar authorities, it's certainly not something that the Ombudsman would endorse attaching any sort of target-driven agenda to.
May I just come in, please, to add, Chairman, to Helen's comments, just around.
Please do.
Thank you, Chair. Just in terms of Councillor Lee's response to the COVID effect on complaints, it might be helpful to recall that it was only in March this year that government guidance allowed for there to be the resumption of people visiting their loved ones in care homes. And I thought, together with many other DASs up and down the country, that when loved ones were going into care homes, not having seen their husband, their wife, their son, their daughter, their friend for nigh on a year, that actually they might be quite shocked with what they were seeing in terms of rate of decline, because so many people living in care homes had such, like everybody, but such restrictions, and had to live not only within the care home, but on occasion behind their bedroom door within the care home. I thought we would see a real rise in complaints coming through. We didn't see that. And I think that's one reason, one reason, and the most important reason that we didn't actually see that increase in complaints was because of the massive efforts that care providers and their staff had gone to in terms of, trying their absolute utmost to not only provide functional care to people during this most dreadful of times, but loving, empathetic care to those people, because they were not, their own loved ones were not able to do so. So I think that, during this period of time, quite frankly, our colleagues who've been working across the care sector have really gone to Herculean efforts, not only to ensure that people continued to receive safe care, but also loving care.
Thank you for that. 5B, we've already touched slightly on 5B, but would you like to continue with 5B, which is the care closer to home? Carol?
Sorry, Chair, having problems unmuting myself. So what you have in 5B are two documents, committee members. The first is the Q4 performance data pertaining to adult social care and housing needs, but also public health. So Director of Public Health may wish to come in. And I'm not going to slavishly go through this because I know how thoroughly committee members will have reviewed these documents in front of you. So I'm just going to highlight certain points. So the first is on page 31 with regards to the integrated discharge arrangements. I think it's fair to say, and why I think this is fair is because we have been, for the second time in only 3 years, selected for our work nationally in the MJ Awards around discharge arrangements. We have been recognised and shortlisted as one of only 7 areas in the country for excellence in terms of how we have integrated our approaches. So our integrated discharge team, sorry, that's what IDT stands for there, have worked well in minimising length of stay in hospital. And I'm very mindful. I've got colleagues such as Darren in the meeting tonight, but we have seen a very marked reduction in the average length of stay in hospital. There are lots of reasons for that, but one of those important reasons are the new arrangements we've put into place around integrated discharge. We are undertaking a review of our early help schemes, the Living Well service, and we're doing that jointly again with the CCG. And really, really importantly, is the long-term, the NHS long-term plan, of course, talks about prevention at scale. And the 2014 Care Act gives councils a legal duty around prevention as well. So the work that we've done around the Living Well scheme, it's been independently evaluated by a national leader in this space, Professor John Bolton. He found that the way in which we were working with the voluntary community sector was really very positive, but we wish to maintain that, if not to further expand it, and therefore we're doing a review. You can see on page 32 we have introduced our Pride in Practice quality strategy in March. That's really, really key because committee members from 2023, the Care and Health Bill, which had its second reading in the House of Commons on the 14th of July, makes it clear that from 2023, the Care Quality Commission will be given a new duty to assure adult social care. And part of that is going to absolutely be looking at the quality of professional practice within our adult social care. So that Pride in Practice strategy of really key importance. Making safeguarding personal on page 33. So basically really very, very key for us there. And what we are seeing is that we have got very good performance against safeguarding personal outcomes. Finally, I think for me around this are some of the really key things, and they start on page 35, the housing needs part of my department. We have completely recommissioned all of the Supporting People programme, and the single person homeless pathway for 16 overs has got a series of new providers, which includes two saints. We have increased the number of units for single people by 25 in terms of stage 2 accommodation for the single homeless, and I'm quite sure that the committee members noted that very recently we opened Howard House, which is the new emergency accommodation for single homeless people, and I'm very proud of what has been done there, together with funds that this council has made available, as well as additional funds which we successfully bid for from MHCLG. What you then have in the rest of the report are measures around the effectiveness of reablement, and that's on page 36. On page 37, you have dolls, and I know that that's very close to the heart of at least one committee member, and he knows who he is. I'm quite sure he'll ask a question in a minute around dolls. And we have seen an increase in applications waiting, and therefore to that effect, I have managed to identify £468,000 in this financial year within the existing budget in order to deal with reviews which are overdue, and that includes dolls. And the Assistant Director for Operations, Mark Howes, is developing a plan for how we can best use that 468,000. You will see that despite the drop that we had in December, our timeliness around safeguarding referrals within 7 working days remains very good, as does our performance around the 28 days completion. We are continuing to see, as page 39 shows you, an increase going on around safeguarding referrals. Most of those, of the 197, for instance, and it is made clear in the narrative in the report above, but of those 197, 92 came from care homes. And what I would say is most of those are around medication errors. It's about correct reporting there, because all medication errors must be reported not only to us but to CQC. Then just around the one area where I am a bit concerned is around the rise in numbers of permanent admissions into residential and nursing homes, that rolling basis there, which is on page 40. What we do know is, as we are getting people out of hospital more quickly, and that's entirely right, entirely proper, entirely the result of integrated working, as soon as somebody goes into a short-term placement, because of various components of lockdown, although we have completely moved the social work hospital team into the community, what we do know is that those people are going into some of those care homes still pretty darn poorly, quite frankly. I'm not a clinician, so I'll deliberately use that user-friendly word of being poorly. And unless we get those people out really super quick, they are more likely to have to remain and become permanent. And it is fair to say that most recently what we are seeing are some real shortages because of people isolating. The conversation you had right at the start of the meeting, we are really beginning to see, as people are being pinged, and what has been coined, I think, within the media as the ping-demic. we are beginning to see the lack of capacity, particularly within our home care market. So we are seeing a rise in the rates of permanency there. So that's the report, and then what you have is a PowerPoint presentation, but I'll just stop there in case our Director of Public Health also wishes to address this report, because it covers also public health.
Thank you very much.
I'm happy to committee to take questions as they arise.
Okay, thank you. Any questions? Councillor Downer and Councillor Mosden.
Thank you, Simon, and thank you for your report, Carol. Simon, I'd just like to ask, through the COVID pandemic, has there been an increase in alcohol and substance misuse? Thank you.
It's a difficult question to answer because of the way it's recorded, in terms of we don't do surveys to understand how people are taking up drugs and alcohol. What we are seeing is more people asking for help, not on a huge scale, but actually we're seeing more people. That might be because they're recognising they've got a problem, or it might be because they're drinking more, but we are working with that, and our service is coping really well. What we're doing is providing more brief advice. So rather than actually being a longer intervention, these people just need perhaps 4 phone calls over a period of a few months, and that really helps them to change that behaviour, called brief interventions. It's working really well.
Thank you. Hello, Dr. Tozer. I just have to say, firstly, that we are all going to really miss you. This is probably this last meeting, and you and I, as we know, have worked really closely together for the last 4 years, and your contribution to this local authority has been absolutely stunning and has put us on the map nationally with some of the stuff you've done with directors across the whole country. So for that, I think we can all thank you. I have a couple of questions for you. Firstly is, where are you currently on budget? Are you over or under? Because as we know, that has to be made up. As we know, the future funding of adult social care has never had a proper answer from anywhere ever, and I don't think this paper that's going through government at the moment has an answer either. So I just like, as this paper's about budget, I'd quickly like your thoughts on that, because I know you do lots of stuff nationally. So it's, where are we on budget at the moment within adult social care of this personal local authority, and what do you think about the paper that's going through? Does it answer the question of future funding of adult social care?
Thank you, Councillor Mosdell. First I'll do the local, for which I'm directly responsible. So the 2021 budget outturn was that adult social care and housing needs overspent by just over £6,000. So as near as damn it as being on budget, but there was a very, very small overspend. We do not yet know the results for June, so the results I'm going to give you next pertain to April and May. So as of the end of May of this year, 2021, we are projecting, and this is a first, we are projecting £195,000 under spend against budget. And to date this financial year, we have delivered £1.12 million worth of savings. And for this year, our new savings target is 1.57. However, we did not achieve just under £1 million. It was just over, to be precise, it was £964,000. Last year of our savings target, we did not achieve, meaning that our savings budget for this year is 2.5 million. And as of the end of month 2, that is May, we achieved 1.12 million, which means that we are also, our finance colleagues generally just apportion our savings budget on a month-by-month basis. And again, what that means is that for the first time, we are over where our profiled savings target should be for this financial year. So that's the local situation. The national situation, ADAS published, that's the Association of Directors of Adult Social Services, published its annual budget survey last week. And it had some incredibly worrying issues within it. Only 22% of all directors were confident that they would be able to meet their statutory undertakings for this current financial year. That's the 21-22 financial year. Only 22% of directors saying that they were confident they would meet their statutory duties. In terms of savings for this year, again, it was even less than that. It was 17% only of directors were fully confident that they would meet their savings targets for this year. But the big headline from the ADAS budget survey published last week was that over 75,000 people across England were either waiting for a package of care, waiting for an assessment, or had an overdue review. That is the first time that ADAS has included those questions in its budget. So, for instance, and so therefore, what does that mean for us locally? I am very, very pleased to tell you that thanks to the hard work of my frontline colleagues, there was, as of Friday, nobody waiting for an assessment. But as of last Friday, we had 506 people who were waiting either for a dole's assessment or for a review. So we do have very much an issue. Frankly, and again, this is not Dr. Tozer saying this, this is from august bodies such as the Health Foundation, such as the Public Health Select Committee, the Select Committee for Health and Social Care, and also the King's Fund. What there is absolute acceptance of is that the minimum additional funding that needs to come into adult social care in order only to bring us back to the year 2010-11, that's a decade ago, you know, as we all know, to bring us back to the numbers of people in receipt of adult social care, what they were back in 2010-11 to now, would require an additional £7 billion of government investment. And it's also fair to say nationally, and this is in fact, last year was the first time, this year has shown even more, that actually local government, through its precept, adds more money to adult social care now than is received in central government grants to adult social care. So what we do have is an ongoing crisis, because I don't think that's too strong a word, around the national funding for adult social care. Everybody has known this, and it was to be welcomed, therefore, that the Prime Minister on the steps of Downing Street on his very first day in office said that the government would publish a plan to, and I quote the Prime Minister, fix adult social care once and for all. We understand, and very obviously, the pandemic has absolutely happened at the same time. What I understand nationally, because I do a lot of national work as a, trustee of ADAS, is that I understand that that plan will not now be long in coming to us. I think it is interesting, though, talking facts, that the Queen's speech, which happened earlier in May of this year, had 9 words only devoted to adult social care, 9 words only. And the Care and Health Bill, which, as I've already referenced, received its second hearing in the House of the Houses of Parliament on the 14th of July last week, had only the following to say about adult social care: that it would introduce the new duty for CQC to assure adult social care from 2023, that it would be enabling the Secretary of State to make payments directly to care providers, and that also it would be reviewing the data architecture of adult social care. Adult social care is mentioned also in a future agenda item that we have on agenda item 6, Chair, around the what we're calling the white paper, but it is now the Health and Care Bill. But when we put this presentation together, it was still the white paper. It does have duties on NHS around cooperating with councils more widely, not only adult social care. So there is an urgent need to have clarity about the future funding of adult social care. There is an equally pressing need around the government's proposals for the fundamental reform, because what is true is that more than 10% of all elderly people in this country face catastrophic care costs. And those catastrophic care costs are defined as having from their own pocket to contribute in excess of £100,000 towards the cost of their care. And their care is not something which is a nice extra for people to have in terms of having a jolly nice standard of living. This is about people being able to toilet. This is about people being able to bathe. This is about people being able to dress. And this is about people being able to eat. None of which I would describe as nice to have, all of which I would describe as vitally important, as is any health service that anybody receives.
Carol, thank you very much. Before we move on, this is your last official scrutiny meeting, and I think it's appropriate to say that this committee recognises and commends the great strides and achievements that you have made in progressing and streamlining, not just within your own sphere, adult social care, not just within your own sphere, but in the context and interactions with others. And I think we'd like to formally thank you in appreciation for what you've achieved for this council, Carol. Thank you.
Thank you, Chair. There's always a we. It's not a me.
Yeah, well, we know that, and when you were off, your team performed very well. Councillor Lilly.
I wish to second that, and Carol, and wish you much happiness in future within that. And it's very difficult to follow the act of your passion that was just expressed now, and I think we thank that for you. That I just want to there's a couple of points. I think it moves on very nicely to the fact that our new cabinet member for adult social care, Councillor Love, is putting forward a motion at the full council on Wednesday, which is very much in line with what Carol has just said about raising this huge issue, that with our high level of ageing population, a high level of people, retired, that, this is a big issue for this island, and we do need to make very strong representations through our MP and directly to about our position in regard to that. My second point was thank you for recognising I am the dolls guy. I have been on this, and I have to say from 4 years ago when it was at the level it was, it's come a long way. I would just ask, could we make a note, Chair, to keep an eye on it and report back. That is something very important to keep an eye on, because once it creeps up, it could have a huge financial effect, as well as the effect on people's lives.
Thank you, Michael.
As well. So thank you for raising it. I was going to raise it, by the way, so thank you for raising it before then. And the last point is you make a very, where you say, this is on page 57, there is still much more to do. You make the point about many of our care homes belong to SME providers, right? And that, I suppose, viability, which is very worrying. So my question is what do we need to do about it? Right? Thank you.
Thank you, Councillor Lilly, and thank you for your kind words also to the Chair. In terms of our care providers, I would like just again to note formally, please, because I'm mindful that we've got members of the media present, But we now exceed the national average on this island. Over 90% of our care providers are rated as good or outstanding. That matters. It's not just some bean counting. It fundamentally speaks to the quality of care that people receive. And, you know, we moved from a position where it was only 65% and we were an outlier for all the wrong reasons as recently as the end of 2016. But it's fair to say that our providers are small and medium sized. So what we're currently doing is we are refreshing our market position statement, and we are going back out to add to our care providers. We did this for our market position statement in 2018-19. I was really pleased because the impact that he had was enormous. But we went out to our care providers to say, can we second somebody into our commissioning and partnerships unit, run by very ably run by Laura Godian. You have to be a good or outstanding provider to work with our commissioners about our market position statement, because our market position statement fundamentally says, how can we support you to be as successful as you need to be, because that's absolutely in our joint interests with regards to outcomes and quality of care for the people we collectively serve. So we went out for ad for that earlier in the year. We weren't successful. We're going back out to ad for that in September. Again, on the advice actually of our care partnership colleagues, the Isle of Wight care partnership colleagues who want to really refresh the market to refresh itself. And I hope therefore we'll get a really good candidate from the private sector to come in, work with for a year. It's a secondment, so we pay that care provider so they don't miss out financially, because in that way we get their expert input into what our commissioning ambitions and the way in which we commission need to be. Equally, we've been working very closely with our health partners and with our CCG colleagues here, and I think especially also the Trust. So moving forward, we have, for instance, really pushed, and my thanks to my Trust colleagues and to Alison as well here, to Leslie and to Alison, we have our Enhanced Health in Care Home programme on the island. That's basically given linked workers, clinicians, nurses, but some of them are therapists as well, into our care homes. But equally, we've put the equipment in each and every one of our care homes around things like blood pressure monitoring, and we've trained then our care homes in order to be able to use that equipment. So how we work and we jointly commission moving forward with our health colleagues, really, really key here. Our occupancy rates, finally, Councillor Lilly, is an area that we take great look at, because basically what the national data would show is that once you get to an occupancy level of below 80%, financially you start to have to ask questions about, do you remain financially viable? And so I'm very pleased to say that we're not hitting that amongst our residential care homes. We do, however, have 2 nursing homes at the minute who are below an 80% occupancy level. So we're looking there to see what we might to do in order to make sure that those businesses do remain financially viable. So I hope that that answers your question. We do a lot of individual bespoke help and support. We have to make sure that our fees, of course, compare well. So as a for instance, at the minute, our hourly rate for home care is £19.43 an hour. That compares with a national of £18.28. So we know that our fee levels compare. And of course, what I will say is we need to ensure that private businesses are viable. That means making a profit. But equally, we are absolutely obsessed with making sure that frontline carers are also paid at a decent rate, because that's where the quality of care matters most, at that front line.
Thank you very much. Can we move on to item 5C now, which I guess is Darren, to give us an update on CQC?
Me, Chair. It's a shared lives is a in terms of 5C, the inspection report in front of you is of a service that we commissioned as a result of Care Close to Home. And you do have, please, a PowerPoint presentation from me just about the refresh of the Care Close to Home strategy, which we're currently undertaking. So 5C committee is which you officially need to receive because it's one of the council services, is the inaugural inspection of the shared life service, which we established on the island. And I'm delighted to say it's a glowing one. It's the first inspection report. We're rated as good throughout. The feedback, the verbal feedback that we had from the inspector was that actually she felt in certain areas we were nudging into outstanding. But this was the very first inspection report of shared lives, and CQC. I'm thrilled that we're good for every single one. They do have a tendency for their very first inspection of any new service of being obviously somewhat hesitant to go into the outstanding. We know we were nudging the outstanding when you read the report and the descriptors for what good as opposed to outstanding means. So I'm very proud of this. Wish to thank my colleagues who delivered it. And very, very important to me because frankly, when the council is a direct provider of services, we must be able to demonstrate that we're in that good or outstanding. And my ambition, of course, is to be outstanding, not to be good. But we have no moral authority if, as a direct provider of services ourselves, we're not at least good. So I commend that report to you, and it's for noting.
Michael.
I wish to, I propose that we also commend this. It's excellent when you actually get good right across, especially this was, also through a pandemic. And I think this particular scheme where you're actually talking about the carer being with the cared for in their own home, right? Through that period of time actually probably shows some real exceptional kindness and caring that's within our community. So I do really commend that this has been an amazing project, I don't know if that project is the right word, service. And I wish to propose that we commend within this. I have one question, which is, you say on page 59 in your other report that there are low numbers. I think it's 23 within your figure. But I think, getting 23 into good is quite amazing. How can this project post COVID, because it's obviously hasn't been able to expand through COVID, how can this be really developed? Because it's always good to take good to make more good. So how can we expand this scheme? Thank you.
Thank you, Councillor Lilly, for your question. So as part of the Care Close to Home refresh, we're going to be increasing the size of the team. And actually, despite COVID, we do have 4 people, 4 households who've said that they wish to be carers, and we haven't had the capacity to be able to, or the ability to be able to go out into their own homes, because what has to happen before somebody can become approved as a shared lives carer is a very, very intensive piece of work, where you have to be going into their home, you have to be interviewing every member of the family, you have to be looking around the household very, very carefully. So we're going to be increasing the size of the team, and we have the resources to do that as part of our Care Close to Home refresh. And actually we do have some people who have expressed interest in becoming carers. So I'm always ambitious. This is shared lives is a proven it's not the only option that we need to make available for people, but it is so proven to be so beneficial in terms of what our key vision is, which is people living fulfilling lives in the communities of which they belong. And having a shared life scheme on the island, which was introduced as part of Care Close to Home strategy, We now need to absolutely make sure that more people can benefit from it. And I'm optimistic if we increase the size of the team that we can do precisely that.
Darren, did you have your hand up?
I have, Councillor Nicholson. I'm so sorry. I don't know whether it's the format of this meeting that would prevent colleagues from seeing my hand. It was on the last item, actually, and I don't know whether it's still relevant now, but I just wanted to say a couple of things. Quite rightly, the committee have asked us to focus on providing integrated care, and I just wanted to wholeheartedly support what Dr. Tozer had said about the integrated discharge team aspect of what we were doing. The hospital discharge process has just been revolutionised from our perspective, which enabled us to see and treat some of the increasing demand from patient numbers that we've seen. So just wanted to wholeheartedly support that. Thank you. The second thing, just to say how important adult social care is to us all, but how specifically important adult social care is to health too. So anything we can do from a health perspective, we would support in terms of the review that's going on that Carol talked about from a national perspective. I can't begin to follow Councillor Mosdale's really very nice comments about the contribution that Carol's made, but wanted to wholeheartedly again support that from a trust, and I'm sure Alison would do from a commissioning perspective. Immeasurable would be the impact that I would suggest. Carol, absolutely astounding. So thank you very much. John, I'm sure you want to know very briefly about CQC informal feedback on behalf of the trust, so can understand the confusion.
Please.
Come to that in a second. Can I make a plea, please? Leslie, Kirk and I need to go to another meeting at 7. Is it possible to consider slightly tweaking the agenda that anything that relates particularly to that suicide prevention before 7 o'clock so we can be present for that discussion?
Yeah, we can go straight to that.
Thank you, that's incredibly kind. If by your permission, I'll feed back on the informal feedback that we've received from the CQC.
Yes, please.
So overwhelmingly positive, I think, would be the 2 words that I would use. And we are very, very hopeful of a positive outcome when we receive the report in the middle of August that we'll need to check. And then in September, the publication of that report. Thank you, Carol. The publication of that report will come out into the public domain. And of course, we'll share that with committee members. And we hope that to be positive. But I can't say any more than that at this stage. But we're really pleased with what we've done, with the support that we've received from all parties and all stakeholders on the island and off the island as well. And that we do expect that to be recognised in the report.
That's excellent news, Darren. Thank you very much for that. Okay, we'll move on to item 6 now, the Wight paper. Now right, we'll go, yes, okay, we'll go to suicide prevention, Darren, if you've got to get away.
Thank you.
So Healthwatch will introduce on this.
Thank you. So Healthwatch started this work the end of 2019 when we were approached by a number of people that had been affected by suicide or who had attempted to take their life by suicide. So we decided to look into it in more depth. We worked with Public Health and the Trust to get some data, to give some context to the feedback that had been shared with us. And there was some delay in publishing the report, but the main thing I wanted to say was that some very positive work has gone on since we started this work. So when we started this work, again, it was back in 2019, people were experiencing difficulties in accessing mental health services, and GPs were expressing difficulties, again, between primary care and secondary care. But I'm really pleased that things have changed. and services recognise the need for continuous improvement. So probably best to hand over to the services now to say actually what has changed and how people are better supported now today.
Okay, who wants to lead on that? Is it you, Alison?
I would suggest, Chair, Stevens on the call.
It's difficult to see people's hands, you see, on the screen.
Thank you. And thank you for that context setting, Joe. We certainly recognise that suicide prevention is a huge priority for us as the whole system, not just in mental health services. We know that 2/3 or more of people who tragically die by suicide have no contact with mental health services. So really this is a whole system thing. But from a mental health services point of view, Overview and Scrutiny Committee will be very well aware of the No Wrong Door strategy that we published in October last year. And that sets out a plan to radically open up access to mental health services. And we've established a new integrated mental health hub, working really closely with our colleagues in the local authority, in primary care and across the third sector to make sure that we've got a really joined up offer for people who are in mental health crisis. So we've seen huge change over a relatively short period of time. And I think in some ways, although the last 18 months or so have been incredibly difficult and stressful for mental health services, as they have for the whole system, actually what it has done is enable us to do some things at pace that we weren't previously able to do. And that includes really stepping up our crisis support for people. So one of the things that we're really keen to do, we've done a number of times in the past, and in collaboration with Healthwatch, we're going to do again tomorrow through the press release that will accompany this report, is share with the public all of the different means of access to mental health services for people in crisis, including children and young people, because we know very sadly that this pandemic has had quite a negative, profound impact on the mental health of our young people in particular. I think that was all I wanted to say. Thank you.
Thank you very much, Leslie. Michael, Councillor Lee.
Thank you. I'd like to actually firstly say thank you for a very comprehensive report. Healthwatch does a very important service on this island. It actually provides a voice for the person who's affected, right? That is going through the pain of that. And also their family and their carers. Their name is on the tin, Healthwatch, and they are to bring that independent perspective on health issues and services and the journey. We talked about, the person journey, the human journey that we need to learn from. And sometimes that journey is okay. And people actually do get a good service. But there is a voice of people that we should be concerned about that don't. And I think that this committee has, had a watchful eye on the suicide prevention, the suicide strategy, and mental health services for a long time. And I think it's interesting that Healthwatch say in its priorities for next year that it's continuing on mental health, and we need to. And I will be proposing later that we actually reenact our task and finish group, because we need to follow this journey of change. And it is great. I know that your team, Leslie's and in the CCG, the GPs, have all been working very hard to actually get there. But we are still hearing voices. I still hear voices in the community that are still not necessarily getting the service that that they need. The problem with suicide particularly is the data is always late, because obviously going to the coroner and that, so we are always late on this data, and we haven't started to look at the levels of suicide during COVID and the suicide attempts of that. And we need to look at that data very carefully, through public health and Healthwatch to actually see the effects. I wish to make two proposals. One is there is a set of considerable recommendations in this report, 1 to 13, and then additional ones for GPs, 1 to 5, on page, I think it's 193 or 29 of the actual report, and 30. So I wish to propose those recommendations go to the Health and Wellbeing Board at its next meeting. And second, propose that we re-establish the Suicide and Mental Health Task and Finish Group that we had before, which did a report, to coincide particularly re-looking at the suicide prevention strategy, which is due for aside, and to make sure in that we actually get the voice of the human in this. We get more voice. We had in the past much more stronger voices, and I am very concerned when I hear of people feeling their voice is not being heard. And I think part of that task and finish group is to get out there and listen to those voices within that. Thank you. I look for a second.
Thank you, Chair. Before we move to the recommendations, could we hear from Simon Bryant, who's the Director of Public Health, please? I'd appreciate that before we move to any recommendations. Thank you.
Yeah, thank you, colleagues. As you know, suicide prevention is a really, really important topic, and we do need to make sure we do all we can to prevent suicide, as colleagues around the virtual table will be saying, and we're working really well together. I think my proposal is that suicide prevention, as Leslie actually outlines, a system approach. We need the Health and Wellbeing Board to take that leadership, which it does, and we can do that. And as we refresh the strategy, and that strategy should come back here as appropriate to be scrutinised by this committee where appropriate in the future. I think we are working really well. I think we need to be really mindful of this very sensitive issue. We do look at the data. We're not seeing the increase that people were expecting in suicide, so we just need to be really mindful of that and really make sure, as Councillor Lee said, we support everybody who's in distress to access the service they need, and we want that, and that's really positive. So we will take that, and we have looked at the recommendations and have really thought very hard about them and responded to Healthwatch on those. So I think that would be the way forward. We've got a workshop coming up where we'll bring everyone together to make sure we do get that feed in to this important topic. As Leslie said, it's around mental health services, but it's much, much wider than that. That's only one aspect of suicide prevention.
Thank you, Simon. Okay, so we've got two proposals. Do we have a seconder for any of those proposals, Karen? Is that for one or for two? Are you right? Okay. I think we vote on them.
Chairman, can I just come in on the second one in particular? Obviously, the first part is going to refer the recommendations to the Health and Wellbeing Board. I would think perhaps the more sensible course is wait for the response from the Health and Wellbeing Board as to how it's going to undertake its review of the strategy, for it to report back to this committee before you consider whether or not you need a task and finish group. I think the work of the Health and Wellbeing, we don't want to duplicate the work. And I think what we need to do is recognise the Health and Wellbeing Board is the responsible body for reviewing the strategy. We'll have a role later on once we find out how they're going to do that and their direction of travel. So not against the task and finish group, but I think it's the timing of that. I think once we've heard back from the Health and Wellbeing Board.
I was going to suggest that we vote on the motions, on the proposals separately, because there's a lot of momentum on suicide again. And whilst I thoroughly agreed with the task and finish group in the first instance, it might be a bit premature and maybe we reconsider it at a later meeting, Michael, if that's all right with you.
I'm happy to withdraw the second one on the basis that we bring
keep
it back
on the back burner.
We bring it back to the next meeting. Thank you.
Yeah. So can we have a vote? Just those in favour of Michael's first motion to recommend the Healthwatch report with the full recommendations to Health and Wellbeing Board.
As long as it is noted that with, you know, the changes, as Joanna has said, have already started to take place. Yes, then I will. Thank you.
Okay, I think we're unanimous on that. Thank you.
Do you want to show that's unanimous, Chair?
Yeah, thank you very much. And thank you for your work, Joanna and Alison and Simon and Leslie and Michelle, I think, as well, in getting to where we are now with this report, which is a great deal of work. Hugely, we need to give, what really struck me was the transition that we now have is it a walk-in off the street service, Leslie? Where's Leslie gone? Alison, was it a walk-in off the street service?
Yes, that's right. We have a safe haven. It's actually opposite the council building. So for those of you in County Hall, as you walk out of the main entrance, you'll see opposite you the Iseropia Wellbeing Service and the safe haven. The safe haven's open from 5 to 10 p.m. Every weekday. It's open longer hours at weekends and bank holidays, and that does absolutely allow people to walk in off the street if they're in mental health crisis and receive support.
It's just such a huge message to get to people. You know, there's so many people that perhaps in years past might have thought it's just not worth bothering, I can't get anywhere, but this is an open door. If you've got any problems whatsoever, it's just walking off the street. Fantastic. Councillor Lilly.
Can I ask a question in regard to that? Are there plans to look at expanding that in other parts of the island? Because for some people, and I represent Ryde, actually getting to Newport is not easy. So walk off the street into Newport isn't, and being the largest residential population on this island, is there any plans to Ryde or the West Wight or Sandown? Thank you.
So we're certainly considering that. There's no definite plans at the moment, but absolutely, I completely agree with you. We need to push our services out to where people are, rather than expecting people to come to us. And that's the thing. I think a general rule for community physical and mental health services. And you'll be aware that we've recently been successful in buying some new property. We already have a space in Ryde, and what we need to do is work through the resourcing of that, and because obviously it needs to be safe. So running a mental health service where people can walk off the street in crisis presents some risks, and so they need to be safely and appropriately staffed for the safety of the service users as well as the staff themselves. So we need to work it through, but I totally agree with you. If we can find a way to do that, that would be fantastic.
And you'll keep us updated, Leslie?
Absolutely.
I've got Councillor Love. Carl.
Thank you for the information. Yes, I would certainly expect as the adult social care portfolio manager that we would be expanding that service in some kind of way, whether it be in an outreach form, you know, to make sure that the service is accessible right across the island. Of course, that does bring forward some complexities which have already been identified, but it would certainly be a priority that we reach out from the centre to all parts of the island at some point in the future.
Thanks for your assurance and support on that. Okay, is there anything else, Darren, that you need to be present for on the agenda?
I would like to be present for the white paper discussion involving Mr. Samuel from the ICS, if at all possible. We'll
go straight to white paper then. And Richard Samuels is going to present on this. Is Richard there?
I am.
I can't see your name, Richard, but yes, you're there. Okay, over to you.
Thank you so much for the opportunity to update the Avian Scrutiny Committee. You've received the paper which provides a brief summary of the white paper as was, and as Carol has says, the Health and Care Bill, which is currently had its second reading last week. If I may just give some headlines about the bill and the changes that are coming down the track, I think it's fair to say that the Health and Care Bill is arguably the most ambitious reform programme for the NHS in a generation. It's 232 pages detailing fundamental changes in the way in which the NHS and national health functions are organised and works in partnership with local government, with wider partners like housing, voluntary sector, industry, and most importantly with citizens, patients, carers and representatives. At the heart of the bill is the ambition to transition from a fragmented commissioner and provider based sector, often working in a misaligned or competitive way, pursuing short-term objectives, to a model focused on integration, using new techniques such as population health management to focus on improving multi-year outcomes for local people. So it is, at the heart of it, a fundamental shift from that market-based commissioner-provider split to an integrated model looking at improving outcomes and well-being for populations over a longer time frame. As Carol pointed out, and incredibly powerful, again, just to add my congratulations and thanks to Carol, the success of healthcare and well-being is inextricably linked. And whilst the proposals and duties in the bill do create a framework for greater integration, it doesn't address the resource gap that Carol identified in social care. It's also relevant to state that the NHS organisations across Hampshire and the Isle of Wight, whilst we are currently meeting our aggregate financial plans, that's not the same as saying that we are currently in long-term sustainability and living within our financial allocation. And one of the means by which we will need to use the legislative freedoms that are given to us is find ways in which we can deliver more sustainable financial performance across health and care. In part, the health and care system on the Isle of Wight, I think, have been modelling the characteristics of place-based partnership set out within the draft legislation. But this has been on occasions in spite of rather than because of the legal framework in which partners operate. So the bill is intended to clean up the legal framework of organisations and place a duty on all partners to effectively adopt some of the characteristics and processes the Isle of Wight have been operating for many years, which is partnership, integration, orientation towards outcomes. Draft legislation has only just landed, as we know, but it does plan for the dissolution of many NHS organisations, including a number of national bodies and including, in this instance, clinical commissioning groups, and the Isle of Wight Clinical Commissioning Group is included within that. And there is an ambition that's replaced by a streamlined, simplified and integrated set of arrangements. Legislation plans to remove some of the historic market-based requirements, including the need to go through a procurement process for services where there may be a legitimate and transparent rationale for awarding contracts to existing providers of care. And so for our providers in the voluntary sector, in the health sector, in social care, where we have historically had to, in some cases, nonsensically go out to the market when there is an already competent and capable provider delivering great outcomes, that burden is potentially removed by the bill, as long as there is transparent and evidence associated with the decision so to do. The legislation is permissive and so allows for locally sensitive proposals to be developed. In this case, a recognition that whilst the bill does propose the dissolution of the Isle of Wight CCG, the guidance and the direction of travel signals the need to continue, indeed strengthen island-based integrated planning and delivery. So what this is a clean-up, but the heart of it is about integration between health and local government, integration between provider organisations has been manifested on the island over the course of the last few years. In Hampshire and the Isle of Wight, we, the leadership community across health and care, are working on a design principle of keep it simple, evolve current arrangements, keep it local where possible, but let's look at opportunities for scale where that adds benefit for our population. I think the question posed by the committee chair was, what's the impact of the bill on the role of the Overview and Scrutiny Committee? And if you look at the bill, it only mentions Overview and Scrutiny Committee 4 times, and each time it mentions that in terms of the clean-up of the nomenclature of the role of Overview and Scrutiny Committees, i.e. it removes the wording of clinical commissioning groups and replaces it with integrated care boards. So with regards to the role of Overview and Scrutiny Committees moving forward, the bill it doesn't affect the role and purpose of the Overview and Scrutiny Committee. That will continue as set under the Local Government Act, just it will require its role to hold to account health and care bodies for the delivery of the components of the bill itself, including the Integrated Care System Partnership, the development of a health and wellbeing strategy for the ICS, the development of the board, etc. So I could go on all night, to be honest, about each of the nuances and content of the bill. I'm happy to do is to look also to my colleagues who've been involved in local developments on the island to reflect on the next steps for the island, and I'm really happy to reflect on how we'll work to evolve local arrangements as part of a connected sense of services across Hampshire and the Isle of Wight. And I have no doubt, Chair, that this will be a regular matter for consideration as part of the work of the Overview and Scrutiny Committee. Final point I'd say is that whilst the technical transition will take place on the 1st of April 2022, the development agenda, how we continue to evolve arrangements working on the Isle of Wight and across Hampshire and the Isle of Wight, will undoubtedly take another 2 to 3 years to come into fruition, because they are, as I said, hugely ambitious, quite far-reaching, and will take quite a lot of work with our citizens, with our partners, with our clinicians to drive the changes we move forward.
Thank you, Richard. Do we have any questions? Sounds like it's early days yet, Richard. I think as scrutiny, we would like to be updated on developments of the ICS, and I know we already have been. Who's got the? Oh, sorry, Darren. Thank you, Simon. Darren.
No problem. Thank you, Councillor Nicholson. Thank you, Richard. That was really very helpful and very clear. For me, I think just a couple of points. The first is we are involved in this whether we like it or not. And I think for me, the vision around local leadership for public health, health and social care under some form of agreed local devolved responsibilities from the ICS is going to be absolutely the thing that we should focus a large part of our management efforts on over the next months and years as we move forward. There's a real opportunity, I think, and Richard's steer really lead, how might we do this? We have a structure set up through the ICP board to take this kind of thinking and planning forward, working with all partners and reporting back through to this committee, but also the Health and Wellbeing Board and a number of other statutory organisations, not least of which the ICS, which would need to endorse and support any proposals as we go forward. And we need to indicate a time frame for the realisation of that vision and what we would need to have in place to enable certain responsibilities to be devolved as we go forward. So that's the crucial thing for me, I think. We can't do any of that in any depth today, Councillor Nicholson, but I think we do need to commit to providing reports as we get further through this process back to this committee and others.
I think that's good enough. Thank you very much, Darren. Councillor Lilly.
I think we should just note that the report, and obviously it's an ongoing one. My only sort of comment would be that we are an island and we have unique needs for our population because of the water around it. And we need to obviously make sure that within this, there is, emphasis about our unique needs as an island, so that that doesn't get lost in the legislation within this. That's just a particular point I would like to make.
I think, Michael, that partners know that Scrutiny will be particularly watchful on that aspect. Okay, so we now move on to item 7, which is our Healthwatch reports, and the first one of those is the dental services. Joanna.
Thank you. Yes, so we did a big piece of work at the end of last year in December due to the huge amount of feedback we were getting from people who couldn't access an NHS dentist. So well over 700 people completed our survey, and the vast majority either had access issues or some problem in getting their dental needs met. We published the report, and I've said this before, and I'm sure I'll say it again, but dentistry is the biggest health inequality that island residents face. Because at the moment, if you've got money, you can pay and get treatment tomorrow. And if you haven't got money, you can only get treatment if it's an emergency, and then it's emergency stopgap treatment. We're particularly concerned about children that aren't accessing a dentist. So we've got a relatively high rate of children that haven't seen a dentist within the last 12 months. So 54.2% of children on the island haven't seen a dentist for more than 12 months, and the national average is 58.4%. So that's a real worry, because we know that dental decay progresses faster in young people. We've been contacted by cancer patients whose cancer treatment is postponed because they can't get the dental treatment they need. So it affects particular groups in society more. People that can't afford to pay, people on low incomes, people on benefits. Some people on benefits can get free dental care, but if you can't find a dentist that will take you on, it doesn't matter. So we know there's a huge issue, and I'll absolutely agree with Michael. So COVID has made the situation worse, but it's worse because we're an island. We know that most dental practices, in fact, all of them for a good period, haven't been taking on NHS patients. We can't go to Portsmouth or Southsea or Brighton to access their dentists because it means travelling and it means additional cost. So island residents face particular issues around dental care. We've sent our report to NHS England South East Dental Team, who are the commissioners of dental services. And one piece of hope on the horizon is that they've agreed to, agreed specifically to do an oral health needs assessment in Hampshire and the Isle of Wight. And that is key, because they will be looking at not only the level of provision at the moment, so what people get, but they'll look at level of need. So where are the gaps? What groups of people are being disadvantaged? And that's the key to addressing the issues. So that's really good news, and we will be strongly encouraging them to do that as soon as possible. There are some other initiatives that are happening. So the Isle of Wight NHS Trust is introducing Mouthcare Matters, which is a great scheme, but we'd like more to be done locally. So this is a system-wide problem, and you can't underestimate the effect it has on people, poor dental care. So it affects people's mental health, their ability to socialise, their ability to speak, to eat normally. A lot of people that contacted us have to eat a soft food diet because of their dental pain and their problems. Some people are in continual pain. It affects people's confidence. The impact's massive on people. So this is such an important issue, and we feel it should be a priority for all health and social care sectors on the island. And I know, having spoken to some people, they agree with us that it's a fundamental issue that needs addressing. Some of the issues are with dental contracts. Healthwatch England are working with the Department of Health to look at this, but that's a long-term solution. We need to find shorter-term solutions for people now that are suffering. But we've started the process, and hopefully there's more good news to come.
Thank you, Joanna. An excellent report. Really disturbing what's happening, how the availability of dentists has declined on the Isle of Wight. Michael.
Absolutely, this is an excellent report, and there has been obviously a number of meetings about this on scrutiny, and I think it has to be a number one thing. About 20 years as a former mental health professional in the West Midlands, I did a whole study about dentistry and anxiety and confidence and mental health. That actually, if someone got good dentistry and their teeth were okay, or particularly physically they looked okay, they were less likely then to go back into mental health services of sign, because obviously if you're a long-term mental health service user, your teeth go, and then that has a knock-on effect to your side. And we have to, this is a link to poverty as well, that you can have whole families that basically teeth are deteriorating within that. And I think that there's been a huge increase because of COVID. And also Brexit. A lot of dentistry came from Eastern Europe and other places, and actually they've gone back. So we've actually lost on a number of practices of actual dentists within that. And Joanna's completely right that there is poor man at the rich man's gate scenario, where if you've got money, your teeth are okay. If you haven't, and you need to be on the NHS, it's impossible to get that on this island. So we have a huge health inequality on dentistry on this island, and we need to make it a priority and talk to our MP and actually really lobby on this issue, support our health partners, that on this island we want a better teeth in the future. And if we try to do anything that we need to do as Scrutiny, we do need to champion this and get this, because this is something that if you are suffering toothache and that your confidence goes, everything goes with it. It's really something that we need to emphasise. So I wish to propose that we support this report, that we recommend it to the Health and Wellbeing Board as a priority on their work plan in the future for that. So that's my recommendation.
Thank you very much.
Chair, I think very happy to hear the report. I think it's worth noting there's some responses in there as well, which sometimes will help to answer the questions that Joanne's helpfully put, and also noting that it's NHS England who commissioned dentistry, so actually a conversation with them, and they have responded, but actually that would be for scrutiny. So I think there's a number of things that, you know, Sugar Smart is a key thing to protect dental health. It's not all about dentists, but dentists are an issue that we need to make sure we are cited on.
We do have a dialogue with the commissioners on it, and I think it's something that the committee might want to consider in future work plans, because there are some exemplary dental practices on the island. The one I personally use in Gray's Walk, for example, if your appointment is at 4:15 on an afternoon, you're sat in that dentist chair on the button, and it's absolutely fantastic, first class service. And I think it might be worth asking them, how do they do it, and could they open other surgeries around the island? Councillor Love, you wanted to say something.
Yes, thank you. I'd just like to thank you for your report on dental and oral hygiene and so on. There is no doubt that there's a crisis developing. This is a matter of funding, okay, because we do know that if you're willing to pay for the service, then you can get an appointment. There's absolutely no doubt about that. But it is a case of that there isn't enough investment from, as has been decided, been described, not decided, wrong word, by Simon about NHS England commissioning it. We need there to be more commissioning and more units given over to the island so that dentists can move forward. The reason that they're not taking on new people is because they don't have enough units of pay to service the people that are already within the service, and therefore we need more units to allow people to exit as new, to enter as new patients. So this is a real equality issue about who pays really, because, and that's not blaming the dentists themselves, this is about who pays for treatment, and our dentists want to provide high quality services. They don't want to provide second quality services, which is often the case from within the NHS budgets.
I welcome this report. I have actually had terrible toothache for over a year through lockdown, but my experience actually is I did go to a private dentist in the end, but 3 dentists left before I got any treatment, so they still were leaving. So actually I think it affects actually private as well. That's my experience. It's terrible.
Well, thank you for sharing that. Councillor Mostyn.
Sorry, I've got one question for Simon Bryant, and I know he needs to leave to catch a boat. Can I ask my cheeky question and then go back onto dentistry?
Please do.
Sorry, I'm really sorry. For me, one of the things that's come out during COVID, and I think it's really important, I don't know whether we focus it on our work plan, is can you give me an update where we are with public health and our focus on obesity? We know across all health services the pressure that it puts on, you know, on all services. Where are we? What are we doing with funding? And what's our future direction with regards to obesity, please?
Thank you, Councillor Morsdale. So a couple of things I can update you on. We, first of all, we were given extra money by Department of Health to roll out some extra weight management services. What we have done is built that onto our brand new commissioned weight management programme, which started in January, really focusing on those vulnerable groups. So thinking about those people with serious mental illness, people with learning disabilities, and those people who find it hard to lose weight. So we focused that extra money there to really get our new service up and running. I think that's really exciting. However, to tackle obesity doesn't require a weight management service because actually we need to change the whole system. So how do we think about the way that people move around? So we're working with the transport department and the regeneration department to think about actually helping people move. We're working with the planners to help people as we plan new developments that people are able to be active. And that strategy is coming forward. We wanted to do that last year, but we've just been delayed because of COVID. So we now have driven that forward. So I do hope in the early autumn, there'll be something that I can share with colleagues here to say, actually, as an island, how do we tackle obesity? So as you say, Councillor Morsdale, it has so many health implications for our population, and we've seen that during COVID as well, that that's been a challenge. So I do hope that satisfies you with doing that work.
Yeah, there obviously needs to be a joined up approach. You can't do it all on your own. So we'll arrange for a private briefing with other departments in the council. Is that all right, Carl? If we do that, yeah.
That'd be really good. Can I ask a cheeky question now about, sorry, I could see you going and I wanted to get my obesity question in. So my question about dentistry is, for me, it isn't just about, I completely get it that it's about funding and the inequalities and stuff like that, but also how do we encourage more dentists to come and be on the island? Because actually, if we had so many that were private and so many NHS, there is only so much work one person can do during a day. So there has been lots of work over the years on how we encourage people to come and live on the island. We need to make, we can say, well, it's, it's all down to NHS funding and stuff like that, but actually we could play a part with us as a local authority to say, if we are doing housing schemes and stuff like that, could we make more of an attractive offer to get a dentist to come and live here? Because if they're not here, they can only service so many people with their paying or their NHS. I haven't seen them, there aren't many dentists I would have thought that got their feet up at the weekend thinking, okay, I've had a really relaxing week. They are working desperately hard. So my ask would be, how do we do as a committee to look at the bits that we can help with? How do we encourage dentists to actually want and locate on this island? Because then if we're helping with them with that sort of putting a roof over their head and, providing them a practice, then they're more likely to want to actually fund people on an NHS basis. I think there are ways that we can think outside the box, and I'd like us as a committee to see if we could work with that.
Yeah, Joanna.
Thank you. Yeah, that is key. We've met with the MP, who helpfully invited some dental representatives on the island to discuss this. And I just wanted to say that the feedback we get about individual dentists is predominantly positive. Once you can find a dentist, they are very popular. But it is complex. So yes, we've lost a number of dentists on the island. It's very difficult for dental practices to train and to host a trainee dentist. So we've got the dental school in Portsmouth. We get one student a year from that, just one, because it's so difficult for dental practices to become a trainee practice. So the MP is working on trying to make that an easier process, because I'm sure we could get more over here.
That's my point. I think we so quickly think, oh, it's the NHS that's funding it, we can't help as a council. But actually, as a local authority, there is stuff that we could do to actually encourage, there's lots that we can do, and not just shut the conversation down with, NHS needs to provide, but there is support and stuff that we can work to go forward.
I think this is a topic that we can carry forward. Obviously needs careful consideration, and I think we need to hear from a number of people, so we can organise some interim briefings on that. Thanks for bringing it up, Claire.
So can I make a recommendation?
Go on,
I'm quite enjoying this. So my recommendation would be that we note all the recommendations that Healthwatch would put in the report, that we do actually set up a task and finish group within this committee, that we can then come up with some of the suggestions and, that what can we do as a local authority to help with this problem, and then bring that report back to this committee would be my suggestion.
I think the first step we would do is have an informal meeting, attract the people, and then see what work has to be done and consider whether it warrants setting up a task and finish group, or whether we can just do it with a. But I think the direction of your proposal is very worthy. So I don't think anybody would disagree with it, Claire.
Chairman, I would also point out that Healthwatch, as the top 3 priorities, will be doing some further work on dental health services. So perhaps we need to link in so there's no duplication, and perhaps Healthwatch can approach it from one angle and the council from another, so we have a real composite.
Definitely a topic we need to keep our eye on, and we will do. So it'll be in our work plan. Right, so I think we're getting near the end now. So we've got.
Were the report and recommendations approved for submission to the Health and Wellbeing Board, Chairman?
Yes. We're unanimous on that, I think. Right, so 5B in the last item now.
Thank you, John. I'll make this brief because time is getting on and it's still warm. So we have a statutory duty to publish an annual report once a year, and it sets out what we've achieved over the year and what our plans are for the forthcoming year. So just a few brief highlights. In the year 2020 to 21, over 2,200 people shared their experiences with us. And that covers a whole host of services. We provided information, advice and signposting to well over 3,000 people. A lot of that obviously was during the pandemic, so we upped our advice and information around COVID. We tried to support the public to understand the changes in legislation and guidance that came out, and we're continuing to do so. We share regular intelligence reports. So during COVID, we did fortnightly intelligence reports that we shared with statutory partners and others. And it just allowed them to know what people were telling us within that 2-week period. Because it's really important to get the message and the views of people to see where they might indicate that there's a problem or they're concerned about something. Those reports are now on a monthly basis, but we're continuing to do them just because it's really important that they're a kind of reflection on what people are perceiving and what their issues are at the moment. We've been working on a project with the Safeguarding Board, and it's a hidden harm project, which is a fantastic piece of work led by the Isle of Wight Safeguarding Adults Board. And they wanted to look at the hidden harm caused by changes in processes because of COVID. And they wanted to look at whether there'd been hidden harm because of those changes. So services such as the police, hospital, the CCG, Healthwatch, other voluntary sector organisations, we all produce case studies. And as a result of that, we've analysed and identified trends and themes, some of which relate to us being an island. And that's caused people problems during COVID. But that's a really good piece of work, and hopefully that the results of that will be published. And just a couple of things we're working on this year, in addition to our priorities. We're doing a project with King's College London, and it's around making homes for people with a learning disability more homely. So throughout COVID, residential care homes have quite rightly focused on keeping people safe. But sometimes that's at the expense of creating a homely environment. So this project, we're working with Brighton and Hove University and Southampton University as well, just to look at what makes a homely environment for people with a learning disability, particularly people in residential care and supported living. And then we're going to produce a toolkit and guide for people at the end of this. So hopefully there'll be some good practice to share. We're also working on a project with the GMC to look at hospital trust complaints procedures. And we're working with the trust on this as well. So that's a great project that starts in September. So there's some exciting things to come. And in addition to that, we'll also be, keeping our eye on dentistry and pushing for progress with NHS England. We'll be looking at mental health services and we'll be looking at access to GP practices.
Thank you, Joanna. Well, as you know, we're already doing some work with the CCG on access to GP services, which is a bit of a concern. You know, I think we've got a briefing on that, Alison, haven't we, coming up?
Yes.
Access to GPs.
Absolutely, Councillor Nicholson.
Councillor Lilly.
I wish to, I've got a couple of points, but one, overall, this is an excellent report. And I think, can we put in our thanks as a committee for the work that Healthwatch do?
Absolutely.
Especially through COVID, staff have had to work remotely, often, you know, apart within that, and have actually produced and highlighted some incredible work. So I think that we should, you know, be thanked for that work. And my last little point was just to put something forward. You mentioned about learning difficulties and residential care. I have nominated through the Lord Lieutenant's office special award for Argyle Street in Ryde by Southern Housing, because that has done incredible work in supporting its residents right through COVID. I have huge feedback from families that within that. There is some examples of excellence out there, and Argyle Street by Southern Housing is one of them. Thank you.
Councillor Love.
Thank you, Chair. Once again, thank you for a fantastic report that you've developed. Certainly, I, as the portfolio cabinet holder, see you as having, Healthwatch as having a central role in all communication and reports that are produced in future. You are the voice of the people, and that voice needs to be listened to. There are, of course, others who help with that voice, but as far as I can see and am concerned, that you are really, really an integral part of this new administration. I'm pleased to hear that that you're in contact with our MP, who doesn't seem capable of replying to any of my emails at all, to be fair. So I'm really pleased that you've got a positive relationship there.
Well, thanks for your support on that, Carl. Well, I think we are at the end. It's just the work plan. Now, members have had the work plan. It is fluid. If you want to introduce any other items to the work plan, then please let us know. Thank you, everybody, for your attendance and participation. It's very much appreciated. And we're actually, by the scale of health scrutiny meetings, we're actually quite early today, but covered a lot of business nonetheless. So, good night, everybody, and sleep tight.